So our first presenter is Ashley Wettlaufer. She's a research methods specialist with the Institute for Mental Health Policy Research and the World Health Organization, Pan American Health Organization Collaborating Center for Addiction and Mental Health in Toronto. She's been involved in CAPE since its inception in 2011, contributing to the development of the 300 plus alcohol policy indicators and leading data collection and validation. So she's a very busy lady right now. Ashley's area of focus include alcohol pricing, labeling, and marketing controls. Then we'll have Tim Stockwell. He was the director of the Canadian Institute for Substance Use Research, formerly Centre for Addictions Research of BC, since its inception in 2004 until 2020. Before that, he led Australia's National Drug Research Institute as deputy director and then director for 16 years. Tim's research interests in alcohol policy include measurement and modeling of alcohol consumption and related harms, and assessing impacts of pricing and taxation policies such as minimum pricing. And then we have Dr. Adam Sherk. He is a scientist with the Canadian Institute for Substance Use Research at UVic and a researcher with the WHO Pan American World Health Organization Collaborating Center on Alcohol and Public Health Policy. His research focuses on alcohol-caused health harms, the link between alcohol and cancer, and population-level substance use policy. He's created techniques for estimating alcohol harms used by the World Health Organization and has contributed to national alcohol harms monitoring systems in Canada, Australia, the US, and New Zealand. And he is the creator of the International Model of Alcohol Harms and Policy, or INTERMAP, which some folks may be familiar with. So with that, I'm going to turn it over to Ashley, our first presenter.
Thanks, Amanda. So good afternoon, everyone, and thank you all for joining us. I'm really excited to see that so many of the CAPE COP members are interested and engaged on this topic around alcohol pricing and taxation. And I just wanted to start out by saying that the impetus for this presentation was actually feedback from stakeholders like yourselves telling us that they know the pricing buzzwords, they can recite pricing policy best practices as described in CAPE and others in foundational documents that sort of rank different policies. But when it comes to the nuances of these concepts, they sometimes feel unsure, and that makes it difficult to advocate for these policies or to support them as they move through government. So what we aim to do today is to talk about some basic principles, review some foundational terminology, and highlight some of the recent evidence related to these pricing policies. And we've also made an attempt to structure the presentation to answer some of those really great questions that were submitted in advance to the event. And like Amanda said, please feel free to pop your questions into the chat. There's no question too big or too small. And with that, we'll get started. So next slide, please. So I just want to talk very high level about why pricing and taxation is important. First of all, it's a revenue generation tool. So in high income countries, alcohol taxes account for 1 to 2% of state revenues. And this can help cover some of the costs associated with alcohol's harms. And I won't get into that too much because I believe Adam's going to cover that later in the presentation, but definitely worth mentioning. But really, these policies are highly effective policies. We see that the WHO Best Buys identifies pricing and taxation in their top 3 Best Buys. The CAPE project and alcohol and ordinary commodity also rank pricing and taxation quite high in terms of effectiveness. But what do we mean by effective? Well, they're a policy mechanism to control consumption and related harms. And I think that's why most, if not all of us are here today, is to hear about how we can use pricing controls to reduce consumption and harms. So very high level, high prices encourage less drinking by people who already drink. This is similar relationship to what we see in tobacco in terms of what happened to tobacco consumption when prices increased and taxes were increased. And the evidence around this relationship is very strong. Since 2006, there's been 8 meta-analyses that consistently report that an increase in price leads to a decrease in consumption and vice versa. But not only does price and taxation increases impact consumption, but it also discourages or delays drinking initiation. And this can be a long-term prevention policy. This can have sort of a ripple effect through one's lifetime by delaying drinking initiation. And then alcohol prices also have an impact on harms. So we see, aside from consumption, that there's impacts on violence, traffic injuries, suicide, STIs, a wide range of alcohol-related harms, and even impacting life expectancy. Next slide, please. So now that we've covered at a very high level the principles of pricing and why these policies are important, I want to cover some of the key terminology that will help us better understand the concepts and research evidence that will be presented today. So basic economic theory says, and you've probably all heard this in some area of your life, as price goes up, demand or consumption goes down. But what does this look like? What does this mean? And how do we describe this relationship? Well, to do that, we use a concept of price elasticity of demand. And this concept describes how a change in price impacts consumption. And to do this consistently, this is anchored in a 1% increase in price. So price elasticities are described as a 1% change or increase in price leads to a % change in consumption. So price elasticity for alcohol of negative 0.5 would mean that a 1% increase in price leads to a 0.5% decrease in consumption. And the degree to this change, or the size of this change, is described as either price inelastic or price elastic. If it's a relatively small change in consumption, then we refer to it as price inelastic. And this is for changes in price that lead to a change in consumption of less than 1 in terms of absolute terms. And price elastic would be a proportionally greater change in consumption. So an elasticity of absolute elasticity of greater than 1. And then we have cross price elasticities, which is the 1% increase in price of one product and how that impacts changing consumption of another product. So for alcohol, this is really relevant. We would want to know, for example, what happens to spirits consumption when beer prices increase, for example. So this, we would use the concept of a cross price elasticity. Next slide, please. So earlier I said that the evidence is clear that the price of alcohol impacts consumption. But what does that look like for alcohol? How can we use price elasticities to describe that relationship? With a 1% increase in alcohol, we see that overall the short-term price elasticity for total alcohol, so overall, is about negative 0.5. And if we drill down and we look at that at by beverage type, we see that it's a little bit different for beer, wine, and spirits, with beer eliciting a decrease in consumption of 0.4%, and wine and spirits a decrease in consumption of about 0.7%. And the price elasticities tend to be lower for alcoholic beverages used most in a country. So this could partially explain why above beer is less elastic than wine and spirits, because most of this research was conducted in high-income countries where beer is the sort of drink of choice, so may be impacting the elasticities at the beverage levels. Consumers reduce their drinking more in the longer term than in the shorter term after a tax increase. So the above elasticities are short-term results, and so we could see that there's a short-term change, and then over time we see that this impact of price change gets enhanced as time goes on. So we see a bigger change. And elasticities can also vary depending on the group. So youth are typically described as less elastic. However, when we look at the harms that youth experience from drinking, we see that price very much still impacts their harms in terms of reducing harms that they experience from drinking. And then heavier drinkers have smaller proportional decreases in consumption, but larger absolute decreases simply because they're drinking more. So if we were to see a high risk or a heavier drinker reduce their drinks from 5 drinks to 3 drinks, that would only be a 40% decrease rather than a decrease from 2 drinks to 1 drink, which would be a 50% decrease. But the 2 drinks versus the 1 drink decrease in consumption has a higher impact on their health, and that's what's important. We want people to be reducing the number of drinks that they're consuming. And other factors that impact the effectiveness of price are other alcohol control measures. So you've probably heard the CAPE team talk about how we need a comprehensive approach to alcohol policy, and although price is very effective, it can't be a standalone policy. It needs it doesn't operate in a vacuum. It operates in conjunction with other policies. So we see when other alcohol policies are implemented, it can have an impact on the impact of pricing controls. Other factors that impact the effectiveness of price would be affordability of alcohol, income, inflation rates, and I won't get into those because I believe Tim and Adam are going to cover those off nicely later in the presentation. Next slide, please. So the takeaway messages so far are that alcohol prices impact consumption and harms. This we know. This relationship can be complex. The impacts on consumption levels and initiation. So pricing impacts both these things. It impacts different priority groups in different ways. And there's other factors at play in terms of what influences the effectiveness of alcohol pricing. Next slide, please. So now that we've covered those key concepts to help us understand the impacts of price, let's move on to what I call the anatomy of alcohol pricing in Canada. So a lot of people tell me that they get really overwhelmed when they try and understand alcohol pricing in Canada, and well, reasonably so. There are many different components that make up the final retail price, so the shelf price that we see when we go into the stores. And so now we're going to review and dig into some of these concepts a little bit deeper as we move through the presentation. So we'll start with supplier cost or supplier's price. So I'll work my way from the left-hand side to the right-hand side of the slide. And the first example comes from the AGLC in Alberta, and I'll just walk through that, and then I'll look at the pricing example from the SAQ in Quebec on the right. So the supplier's price, this is the cost of manufacturing the product as well as all the costs related to delivery and marketing of the product. So this gets us to the warehouse in the middle. On top of the supplier cost, the excise taxes get applied, the wholesale markups get added, along with the recycling fees and the bottle deposits, and finally, the sales taxes. Then, at the retail store, we have these components in addition to the retailer margins or retailer markups. And I've also included this example on the right from Quebec to show that there are variations between jurisdictions. So not only are there lots of different pricing components, but there's different components that go into the final retail price depending on jurisdiction. In some cases, both provincial and federal sales taxes get added. And in some cases, like in Quebec, there's specific taxes on alcohol that get added as well. And we see this in a few other jurisdictions. I know PEI stands out in mind as having a higher tax applied to alcohol. Next slide, please. So the next pricing component we're going to delve into is the markups. And this part of alcohol pricing has recently been added to CAPE 3.0. So we're now just at the tail end of looking at markups across jurisdictions. And being a bit of a pricing nerd, I'll say it's pretty fascinating to see all the different variations in markups. So when we say markups, what do we mean? Because there's was a lot of mystery around this concept. Markups consist mostly of operating expenses and profits. So I will sort of colloquially refer to these as profits. In Canada, we see mainly two types of markups applied to alcohol products. The wholesale markup, which is the profit that is applied by the distributor when sold to the retailer. So for example, when they sell to licensees. Then there's the retail markup, which is the profit that is applied by the retailer when selling to the general public. What can make this pricing element confusing? There's various ways in which markups are set, and they can vary by beverage type. Some are set in terms of the percentage of landed costs. So this is the cost of alcohol after excise taxes have been applied. Some markup structures are also set by price per liter of beverage. And then we have some which are set as a combination of the two, where the markup is set as a proportion of the landed cost up to a certain threshold, and then a rate per liter of beverage kicks in and is applied after that. The last point that I want to cover, and I think Tim's going to touch upon this as well, is whether markups are a tax. So because our government retail set up in Canada, because we have a government retail set up in Canada, this can sometimes be confusing or unclear, but markups should be thought of as the profits, of course, accounting for the costs of operating and creating the product itself. But overall, we think of markups as profits. Because these profits sometimes go to the government, they are sometimes referred to as a tax. Sometimes in the media, we hear of very large proportions of tax being applied to alcohol. This is portrayed very negatively. What is happening is that sometimes the markups are being accounted for in there and sort of inflating these proportions. And I think Tim will walk us through the true proportions of taxes applied to alcohol in Canada in his presentation. So I'll turn things over to Tim next to walk us through some of the other concepts or other components of pricing, including the proportion of tax truly applied to alcohol. Thank you.
Thank you, Amanda. Yes, good morning, good afternoon. So Amanda described herself as a pricing nerd, and there's a whole group of us here, and I proudly count myself as a pricing nerd. I've been really interested in looking at taxation and pricing policies through a public health lens. And this makes the people who run the alcohol businesses and regulate them quite angry sometimes, because we have concepts that they think are ridiculous, like looking at tax per standard drink or price per standard drink. And the idea here is that we're looking at applying incentives across the whole of population that influence how quickly put ethanol in their bodies and thereby do themselves harm, or they might harm others. And so the whole public health piece here is looking at how pricing and taxation strategies operate in ways that either favor public health or actually run against it. And I'll give you some examples where the way things are set up now are really, really bad for public health, and make it clear how they can be improved. So I'm going to talk a little bit more, dive down a little bit deeper down this rabbit hole of how the prices are set up and what they do, talk about objections to the idea that we should change prices and taxes for public health, or ideas that they don't actually work in the way public health proponents suggest. So let's see how we go. I'll try and move the slides. Amanda hasn't given me the privilege. There we are. Thank you. So this is a gross oversimplification, but sometimes simplification is good because you'll see how complicated it is. There's the production. This is how the prices end up being the final retail price. And I know Ashley's covered this in some detail, but just the idea that there's production and delivery costs, and then the federal excise taxes, which are varied at different rates for different products, different strengths, wherever they come from, who makes them. There are not only are there thousands and thousands of different alcohol products in Canada, there are thousands of different ways they're taxed, but they somehow all are represented by this little flowchart here. So the excise tax happens early on in the process and gets multiplied with the profits and markups. So it's a very important piece, and it's applied differently. And the very last piece that's done, forget container deposits, are these sales taxes. You know, whether it's the federal GST or the provincial PST, or sometimes combined as an HST, let's not worry about that, then get the final retail price. Now, I should say the private versus government rates for profit, mostly when we've looked at this and studied it, the private retailers and also wholesalers, when you're looking at wholesale markups, charge more than government. Government tends to do a fairly efficient job of keeping these prices down, which is a little quirky because for public health purposes, we'd like them to be higher. So anyway, but it's important when we think about whether this is a tax, actually, the government tends to be leaner here and have smaller profits and markups, or if whatever you want to call them, than the private sector. Next slide. So just talk a little bit about pros and cons of these different taxes from a public health perspective. So the excise tax, as I said, are multiplied by everything that follows. But the problem is they're often, because they're volumetric, which means they're calculated by how much liquid. For wine and beer, it's just the amount of liquid, how many litres, it doesn't matter how much alcohol. Spirits above 7%, it's a litre of ethanol, but they're not adjusted automatically with inflation. And I'll show you how that's not been good for public health in Canada over the last few decades. So the weakness of these volumetric excise taxes is they just stay fixed. They don't change. They don't keep up with the cost of living unless the government makes an effort to do that. And since 2017, the present government has actually done that, which is good. Sales taxes do keep up with inflation because they're calculated the percentage shelf price. So whatever goes into that production, distribution costs, they're just multiplied. So they do keep up with inflation. The trouble is that if the drinks are cheap to make to begin with, they could be cheap, high strength drinks, they stay cheap. So, you multiply something a little bit by the same amount, it's small, it stays small. The ideal would be a combination of the virtues of these two approaches. Really, if you scrapped all sales taxes, you only had a high excise tax, which was charged for a unit or standard drink of ethanol and indexed to the cost of living automatically. You could do it quarterly, annually, but that would be the ideal from a public health perspective of keeping these incentives in place and not having them eroded. Next slide. I think I've said everything except a 0.3 excise taxes. It's probably actually since the early 80s, they stopped being adjusted to inflation. In 1991, the GST came in and a new rate was calculated, a lower rate for the excise tax. But since then until 2017, the excise taxes in Canada lost 58% of their value. So alcohol, this basic tax that goes in at the beginning, it gets multiplied, lost over half of its value over the intervening period. And there was intense lobbying, and I want to talk about some of the industry arguments and lobbying against the reintroduction of indexing excise taxes in 2017. Next slide, please. So I'm going to give you an example of how you can look at this in two ways about how the industry used data to make out that they're being absolutely clobbered and we're all being ferociously charged for our alcohol at increasing rates. There's an example using UK data by Colin Angus at the University of Sheffield. Next slide. I thank Amanda for finding this nice example. So if you look at this slide, you could make out that the alcohol duty, by the way, is alcohol tax. So alcohol tax rates are as high as they've ever been. So over time, these are the average rates of tax for different beverages. They've all gone up over that 40-year period. And so you can say, isn't this shocking? And of course, these aren't adjusted with inflation. Next slide, you'll see when you do an inflation adjustment, they're actually historically low rates. And in Canada, okay, they've maintained their value for the last 5 years since indexation was introduced, but there's a massive loss between 91 and 2017. So beware of arguments. So I'll show you some of the next slides. There's a massive campaign that continues. Here's Spirit Canada with an urgent call to repeal automatic escalator tax. So they call it indexation an escalator. It's not an escalator. It's all about keeping pace with inflation, keeping it exactly the same. Without that, it's de-escalating. So this is nonsense. Another piece from the next slide from the brewers, which They claim the Canada's beer taxes are 5 times higher than the US beer taxes. Well, the US hardly have any beer taxes, so it's a very easy claim to make. But they're also counting their markups, their profit, the government markups as taxes, which is ridiculous because they're less than the profits taken by the private sector. And then this highlighted claim that 47% of the price of beer purchased is made up of tax. So we were asked, my colleagues and I, Adam and Sam Churchill and I, to actually work out how much tax is charged as a percentage of the final retail price on typical alcohol. The next slide. We published this a couple of years back. If you look at Sam Churchill, you'll find this piece, or we can send it to you. And so it looks for the major categories. The final column is the percentage of all taxes that are made up in the final retail price. So for beer, it was just about 22%, wine, 20%, spirits, 31%, coolers, 22%. And you can see the profits and how it's made up from excise and sales tax. So next slide. Now, but the industry were claiming, the distillers said that 80% of their prices were due to taxation. Well, it's 30%. They were counting markups, which are their profits. Anyway, so the brewers were claiming about 50% of beer prices were due to taxation, when it's actually only 20%. And again, it's inappropriate to call markups taxes, their profits, and in a private system, there'd be higher prices than the government charge. Next slide, please. Now, okay, this is, I was talking before about how things are set up at the moment is really bad for public health. And here's an example, the way the excise taxes are set up. They give stupid incentives. They give incentive to consumers to choose high strength, cheap drinks. So this is just looking at coolers, and the different colors are different strengths. So from left to right, you're starting blue at 3% strength, and that sort of pinky color is 10%. And this is repeated for wine-based coolers, malt-based beer, and spirit-based. And you see how they change. And the y-axis, the height of those bars are the amount of excise tax paid per standard drink. And of course, no one else except us and public health people would care about this. But this is hugely important. These are the incentives for how much ethanol, or how quickly people will put ethanol in their system and cause harm. So on the left, we've got the wine-based one. There's a little jump at 7%, that sort of turquoise color, because there's a higher excise tax on wine that kicks in at 7%. But otherwise, these excise taxes are charged for the amount of fluid, not the alcohol. So the more alcohol, the higher the strength, the lower the price per standard drink. And if you want to get drunk or get as much alcohol as possible, you go for the highest strength cheap drinks, and that's very effective. Beer, it's like a perfect thing. So if you go from the 3% has got the most tax per standard drink, and the 10% has got the least. Spirits, there's another threshold coming in at 7%, like with wine. So you get this uniform, because then it's charged at a uniform rate per litre of alcohol, which is good. And below 7%, you get this ridiculous escalation where the least, the lowest strength drinks are charged the most excise tax. So perverse, opposite incentives of what a public health model would require. Next slide. So a few misgivings people have about taxation and pricing policies, and these will probably be familiar. The most common one, I think, is the idea that, well, these are all common. They punish moderate drinkers, and they won't affect the heavy drinkers or alcoholics. They lead people to substitute with non-beverage alcohol and or illegal drugs, so they don't do any good. They'd be compensated by cross-border trade. One I found slightly strange is worrying that they increase the profits of the alcohol industry. That applies to minimum pricing. I think that's actually not such a bad thing necessarily. And they have adverse effects on poor people. Next slide, people. So let's look at a little of this, and I'll just touch on this as quick as I can. There's the evidence for unintended consequence, by and large, from these policies is weak. There's data on, I'm going to show you some examples of how these price and tax policies directly affect rates of death and hospitalizations, which basically can only happen if they work and there's not a lot of compensation. Look at how these impacts vary for people in different income groups, and also get self-reports from heavy drinkers and people with alcohol use disorders about the effects of high prices on them and their drinking. Next slide. So here's a nice example. There's lots of examples of this, but this is just a nice clear illustration. This shows the impact of 2 tax increases that were introduced in Alaska over the last few decades on rates of alcohol-related deaths. So each time basically the point here is each time the tax came in, there was a rapid drop in deaths. And then it gradually, they go up because there's no indexation. That's what's going on. The population's going up and there's no indexation. Now, these drops would not occur if there was if everybody was drinking non-beverage alcohol, or these deaths, or there's cross-border trade, whatever. So it's very important to realize, because they're effective, however much substitution people are worrying about, isn't having much effect, and there's quite good detailed evidence for that. Next slide. I will keep going. Next slide. Thank you. We've also asked people on our managed alcohol program research and people with alcohol use disorders living in shelters. There's several hundred people we've asked about how they cope when they can't afford alcohol. And the most usual coping responses they describe involve actually drinking less alcohol and not having really too much adverse effect. So they would go into treatments, they would just simply wait for the welfare check, they'd collect containers for recycling, they might use more cannabis. Very few in comparison report resorting to crime to get money for drink or consuming non-beverage alcohol. And these findings have been replicated in other countries, including recently in Scotland. Next slide. Here in British Columbia, my colleague and I, Jinkui Chow, analysed the effect of minimum price changes in BC in areas with different levels of income. And basically, there's this thing, the harm paradox, that people on low incomes get more harm from their alcohol per litre of alcohol drunk. However, minimum price policies have the biggest impact on low income groups. And this has also been shown in the UK. So, it's actually a way of reducing health inequalities. These policies have beneficial effects on the health of low income drinkers, as well as people in their lives who might be affected by their drinking. Nearly at the end, next slide. Some conclusions. So I hope it's clear, and it'll be more clear when Adam's been talking, that there's enormous untapped potential in Canada to use price and tax to improve public health outcomes. Excise taxes have lost nearly 60% of their value since 1991, so there's room for improvement there. Present ways in which excise taxes are used provide incentives for the production, sale, and consumption of cheap, high-strength products. Pricing strategies have a disproportionately positive effect on people on low-income groups, and so it can be a powerful tool to reduce health inequalities. And unintended consequences are often feared but rarely realised, and I'm sure there'll be questions about that. That's probably as far as, and now it's over to you, Adam. Thank you.
Great, thanks so much, Tim, and thanks so much, Amanda and Ashley, for the introduction. Thanks for inviting me. So hi, I'm Adam Sherk. I'm going to talk about minimum pricing and minimum unit pricing. And today we'll talk about the definitions and some evidence and impact of those. Could I get the next slide? So I'm just going to define my presentation terminologies. I think that the way that we use words are really important, especially when we talk to policymakers who have the potential to implement these policies. And so I try to be very, very clear and have a lot of clarity in the terms that I use. Well, you may or may not agree, but this is what I'm going to do throughout the presentation, just so it's clear. So I use the term ethanol to mean the pure alcohol in the beverage. It's even a little bit unclear to call it alcohol, I think, because I think typically most people would use alcohol to mean like the entire beer, like the whole beer that you're drinking, but not just the pure ethanol, the 5% or whatever of that beer that's made up by the psychoactive. And I really try to do this to call both drinkers and standard drinks. I try to use like ethanol and alcohol user. I drink lots of things. I drink water, I drink coffee, I drink soda, and like once in a while I use ethanol. But I didn't, even before I started in the field, it didn't make any sense to me to call an ethanol user a drinker. It's like we drink lots of things and this is like the least of them. And then in terms of standard drinks, I try to call these again what they are, which is an ethanol unit, so it's an amount of ethanol, it's an amount of pure alcohol in what we're using. It's standard drink to me, like as long as you understand that it's amount of ethanol, it's clear. But I think that the general population will take it as an amount of beverage, which Tim was talking about in his presentation as well. So throughout the presentation, I'll use both like in brackets, but what we want to get at here for a unit price is an ethanol unit, an amount of ethanol. If we could go to the next slide. So my presentation's kind of easy compared to Ashley's and Tim's. Like the components of tax are quite complex. They go together in different ways and they build on top of each other. But now I just get to talk about prices. So we're going to switch gears here, which is why I have the gears along the left-hand side. Stop thinking about tax, stop thinking as a regulator, as a government that's adding these different components. The price is the price that you pay at the register. And so we can think here more like buyers. We don't have to be buying ethanol. We can be buying whatever we like. We all buy something. Now we're the buyer and the prices are the final price paid. So that, the taxes are components of this final price paid, but they're not the price. The price is the price. I'm going to call it price paid because it's a little bit unclear here. The shelf price, like what we see in the store, that's called the retail price. When you bring it to the till, to the register, the tax is added on top of the retail price. So the price paid, I think, is very clear. That's what we pay from our pocketbooks. Now we're thinking as, the buyer. And that price paid is shared by ethanol retailers, the government or private stores, by ethanol producers, and by the government through the different tax components. The price paid, I'm going to include, that's fine, you can go. I'm going to include the sales tax, but not the bottle deposit. We just have to make a decision here. The bottle deposit, you can get back. So I think it's kind of disingenuous, although you do pay it, but you can get it back. So I'm going to not include the bottle deposit in the price paid. Now for the minimum, and I'm kind of moving through the different words of minimum unit pricing. The minimum is this. So for some amount of either beverage or ethanol, and that's what this presentation will be about, talking about the difference between those. A minimum price defines the floor price below which the product cannot be sold. So it cuts off a part of the marketplace, and we'll have graphs and things to show how that works throughout the presentation. And there are different minimum prices typically. They're for on-premise establishments like bars and restaurants, and off-premise establishments like ethanol stores, where you go to buy your alcohol and liquor and you take it away to consume it off-premise. Next slide, please. And now we talk about the unit. So what can minimum prices be set on? What can these prices be defined on? So they are set on either the first way, and Tim talked about both of these, but he talked about an amount of beverage or an amount of liquid. So here, sometimes they're set per liter, sometimes they're set per bottle of beer. For the presentation here, I'm going to choose an exemplar, which is the bottle of beer with 341 milliliters. And so minimum prices can be set on the amount of beverage, regardless of how much ethanol is contained in that beverage. If we go to the next slide, or it can be set on the amount of ethanol, which the ethanol unit, or this is also called a standard drink. So if you hit forward, there's going to be a couple things show up. Yeah. So an ethanol unit or a standard drink in Canada is defined as our most common alcohol container, which is a bottle of beer, or at least, this was how it was. That's changing a little bit as the marketplace changes. At a typical strength of 5%. So an ethanol unit is the amount of ethanol contained in that bottle of beer at 5%. So it's, as you can see there, 17.05 milliliters of ethanol. And sometimes this is represented in grams, like the weight, so you can weigh it on a scale. That's the conversion into grams. If we go forward. Here, I want to talk a little bit about the terminologies, the difference between a minimum price and a minimum unit price. So again, and especially when talking to policymakers, we need to be very clear about what we mean. When we put the unit in there, I'm looking at the second one, we're talking about ethanol units or standard drinks. So the minimum unit price sets a floor price on an ethanol unit. It's absolutely harmonized across all beverage categories like beer, wine, and liquor, beer, wine, and spirits. But a minimum price is broader. It can mean a floor price set on a unit of beverage, or it can mean a floor price set on a unit of ethanol. So as we have in the box at the bottom, a minimum unit price is a particular type of minimum price. And yeah, we have to spend time getting comfortable with those definitions. That's how they're used, but we need to really understand what they are and be able to describe them to policymakers so that we're consistent as a field, as people that are trying to provide evidence for policy. And beside those two, oh, can you go back a slide, Amanda? Oh yeah, one more. Yeah, okay, here. So throughout the presentation, I have these two examples and I carry them through with graphs and examples. So when I'm talking about a unit of beverage, I have the little beer bottle icon. So this is, regardless of how much ethanol is in it, it's about an amount of beverage or an amount of liquid. And then if we go to the next slide, I have the little ethanol molecule. So that, right, the ethanol molecule is when we're talking about a unit of ethanol, a unit of pure alcohol. So now if we go forward, right, so here the minimum price, a minimum price is a broader term that can refer to either a minimum price of beverage or a minimum price of ethanol, the icons on the left. A minimum unit price is always specific to a unit of ethanol or a standard drink, same thing. If we go to the next slide. So in the broader sense of minimum prices, about either an amount of beverage or an amount of ethanol, all of Canada's 10 provinces have some type of minimum price for ethanol in either liquor stores and or bars. So it's sometimes on premise, sometimes off premise, sometimes both. We talked about this yesterday as a group. There are no, as far as we know, there are no minimum prices of either of these types in the territories as of yet. If we go to the next. And now I'm going to build up these with examples from in Canada and then international for the unit price. So there are kind of like three main types of minimum prices that are in practice and in use around the world. The first is a minimum price per liter of beverage, and this is how we have it, for example, where I am in British Columbia. These are like per a liquid amount, and they're not differentiated by ethanol strength. Then I'll go down to the third one, so the minimum price per unit of ethanol. This is where the ethanol itself is priced. This is where the standard drink is priced. It's a true minimum unit price because it's based on a unit of ethanol. And this is what's been implemented in Scotland and Wales and Australia, Northern Territory. There are no unit prices. There are no minimum unit prices in Canada. And those are the only three that I know of that have been implemented in the world. And then going back to the middle one, the second one, there's kind of one in between that has a little bit of both. They're called banded minimum prices. So they're minimum prices per liter of beverage, but they're in strength bands. And I'll show you an example of this. A Canadian province that has that implemented is Saskatchewan. And then because, you know, for health and happiness, what we're looking at is the ethanol, right? The ethanol is a carcinogen, the ethanol is a psychoactive. The closer that we get to pricing ethanol, the stronger the strength of the public health intervention. This is a little bit of my own interpretation. You know, there's not one article that looks at that particularly, but being involved in the field for a long time, that's my interpretation of it. To the next slide, please. Thanks whoever said in the chat that you enjoyed the icons. I looked around for that ethanol molecule and I thought that might be a good way to switch between the two frames, because I think typically we're in this one frame where we're thinking about the amount of beverage, and in public health, surely we should use this other frame, which is the amount of ethanol. And so I was trying to think of a way that kind of encapsulated looking at both of those frames at once and thinking about moving between them the way that we describe it to policymakers and colleagues. So minimum price, this is how it is in BC. You can hit forward and one more thing's going to come up. This is the minimum price per liter of beverage. So Kara and our previous presenters have this great article that summarizes how this looks for some Canadian provinces. Right, so if minimum prices are not set per ethanol unit, then the price of ethanol differs dramatically as you increase the strength, as you increase alcohol by volume. So you can see how the price per standard drink in this graph, as the strength increases from left to right, the price per drink goes down. And this is across all of those provinces. You know, some of them are a little flatter than others, but in general, when you set a price per liter of beverage and not unit ethanol, you get these, like Tim said, a perverse incentive to search out this ultra cheap ethanol. If we go one slide forward. Okay, so this is how we have it in BC. I'm just using BC as an exemplar. This is the actual policy directive. And if you go forward, it's gonna zoom in on that table. So these are the minimum prices in British Columbia right now. So they're per liter of beverage, per liter of liquid. They have nothing to do with the ethanol that's contained in the container if you hit forward. And so the example that I'm going to use from the beer icon is a bottle of beer. If you hit forward, this one bottle of beer. So per liter, the minimum price of beer is $3.19 per liter. When we make this per bottle, it's $1.09 per bottle. So that's the minimum price of beer in BC right now. If you go forward. Here, I want to show how the ethanol units vary over the strength band. So now beer is so strong. Some beer, craft beer is so strong, going up to 10% ethanol by volume. So here I just have the number of ethanol units in a bottle of beer, right? Like, look how much it goes up. There's 0.4 ethanol units in a bottle of beer that has strength 2%, all the way up to 5 times more than that. There's 2 ethanol units in a bottle of beer that's 10%. 10% is pretty strong. But, you know, 8%, that's pretty common nowadays with the craft beers and different things. So if we go forward. Now I'm going to talk about a type 2 minimum price. So these are those minimum prices that are still per liter beverage, but now they're in strength bands. So this is how it is in Saskatchewan. If you go forward, I'm going to show a page of that product ordering guide, which is where I found the minimum prices. If you go forward, a little box will show up. It's a little bit offset, but supposed to be over the 6 bottles one. So the 6 bottles, I've divided those by 6, and you can see underneath it where it says prices shown include the tax and the refundable deposit. But for purposes of analysis, I remove that refundable deposit because you can get that back. So I don't include that in the price paid. If you go forward. Yeah, so now that we have 2 different types of minimum prices, I start to show graphs. So this is the minimum price per bottle of beer, per amount of beverage, but it doesn't talk about ethanol. It's just about the container itself. So in BC, we have a consistent minimum price per bottle of beer. It doesn't matter what strength is in there. The price is the same. In the red line is Saskatchewan, but something's a little wonky with the slides when they transferred over. But if you go back, I guess. Yeah, so the red line is Saskatchewan. So as we go up, the price is consistent at $1.50 up till 6.5%, and then you get these jumps. You get this kind of sawtooth because they have those strength bands. So the price of the bottle at least increases as the ABV goes up. If you go forward, so now it's the different frame. We're moving away from the amount of beverage and we're moving to the amount of ethanol. We're thinking about ethanol units. When you think about ethanol units, this is what the minimum price per unit looks like in BC. It just decays. So the higher the strength in the bottle, the lower the unit price. You're getting that ethanol for cheaper. In Saskatchewan, it also decays, but where they have those bands, you get a little bit of a sawtooth, right? And the Saskatchewan graph is higher because they set a higher price. And then now I want to have that red circle down there where this is the price per unit ethanol, down under $1, even $1.25. This is what we call ultra cheap ethanol. It's extremely harmful to the population. It's just really cheap ethanol, and people that are searching for ethanol know how to search this out. Like for example, when I was a student, we all drank this beer in Ontario called James Ready 5.5. Not to pick on any particular brand, but the 5.5 was the percentage, right? It was the same price, but it was 5.5% ABV. So you're getting an extra 10% ethanol for free, and everybody just kind of knew that, you don't have to be a mathematician to figure this stuff out. So when you're searching for ethanol units, when you're drinking a lot for trying to get it for cheap, you know what this ultra cheap ethanol is. If we could go forward. Now we move to the third type of price, minimum price, I should say. So this is where the minimum price is set per unit of ethanol. There are 3 implementations of this around the world. If you hit forward. So from left to right, Scotland, Wales, and Australia. I'll congratulate the Australians for making the knockout round of the World Cup this morning. The second line is the price in the local dollars and pounds and Australian dollars in their units, because the units are different across countries. And then if you hit one more, here I convert it to Canadian. So in the 2 UK parts of the UK, the minimum unit price, this is for our unit in Canada, the Canadian unit. The price, the minimum price is $1.36, and in Australia, it's Northern Territory, higher, it's $1.57 per Canadian ethanol unit. We go forward. Go forward, it'll bring up the graph. Okay, so now we're in terms of our frame, we're thinking about a dollar amount per amount of beverage. It's a price per bottle. We have the bottle icon. In BC, the bottle price is consistent regardless of ethanol strength. If we hit forward once, Saskatchewan, it's consistent, but then it jigs up where we have the strength bands. Now, if you hit, yeah, you can hit it twice. So the Scotland and Wales and Australia implementations, when you price ethanol, when you have a minimum price of ethanol, as the bottle strength increases, so too does the price of the bottle. If you go to the next slide, we're going to change our frame to think about ethanol. We remember that if we bring up the red line for British Columbia, the price of ethanol decays in BC because it's set per liter of beverage and not per ethanol unit. The price per ethanol unit decays. Saskatchewan similarly, but it has the sawtooth for the strength bands. And now, you know, the big reveal, right? So in terms of ethanol units, and this is the point of a minimum unit price, you can bring up the next one as well. And it should be in the legend, but it's not. So the green line is Scotland and Wales. It's a consistent price per unit, a minimum price per unit. That's the point. And then Australia's is similarly just identical. It doesn't matter what beverage category you're in. It's just pricing the ethanol, not tax. That word has nothing to do with my presentation. Okay, so if we go to the next slide, right, and also just reinforcing that ultra cheap ethanol down there. You get those perversions. You're going to get that ultra cheap ethanol when you price the beverage instead of the ethanol. And for those who are searching out ultra cheap ethanol, they'll be able to find it. So one of the virtues of minimum unit pricing is it can remove this ultra cheap ethanol from the marketplace completely by setting a price on ethanol, a minimum price on ethanol. If we go forward, I want to talk about, I'll go pretty quickly now, but I'll talk about some of the research in the Canadian and global context. Definitely it's shout out to Tim Stockwell I'd like to give. He did a lot of this research when the minimum prices started changing in Canada. And this really he did so much work over in Scotland and Wales, driving toward those unit price implementations, which was so important. So he and our other colleagues here, and Ashley as well as on this article, there are 2 minimum price implementations that were studied a lot in Saskatchewan and BC. If we go forward. So this is in the Saskatchewan context, and this is talking about those elasticities that Ashley had at the beginning as well. So a 10% increase in the minimum price, statistically significant, reduced the use of, and I'll just go right to total ethanol, it reduced total ethanol by 8.4%. And this is that banded minimum price that's implemented in Saskatchewan. It's kind of, it's not as effective as a unit price, but it's more effective than a non-banded one. And also importantly, along the bottom, a significant shift from high to low strength beers and wines, because a unit price or the banded minimum price, which kind of tries to replicate a unit price, it provides an incentive for ethanol producers to make things that are lower strength. So that could be a public health positive. To the next one. Some informal reports of benefits from, this is from, Tim gave me these. So higher prices for cheap booze cuts binge drinking, Saskatchewan fines, late night violence and vandalism in public places has been dramatically reduced. If we go to the next, now this one was in BC. Some findings, the impact on alcohol caused harms. So 10% increase in minimum prices, reduced alcohol specific deaths. Alcohol specific deaths are like alcohol poisoning, alcohol use disorders, things that are definitely caused by alcohol, down by 9.3%. Alcohol caused chronic deaths like alcohol caused cancer, liver cirrhosis, heart disease and stroke, down by around 20%. Other decreases as well. To the next slide. Now in the global context, so the true unit price implementation, a minimum price based on a unit of ethanol. In Scotland, that increase in the price per unit was like a commensurate decrease in ethanol use, like almost 1-to-1. So for a unit price elasticity, at least in Scotland and Wales, the elasticity seems to be around 1-to-1, 1% increase in the price per unit, 1% decrease in ethanol use. And that's from that article of Peter Anderson. Next slide. Now I'm going to just fairly briefly talk about the indexing of minimum prices or taxes to CPI. First, we have to have some concept of the real versus nominal values. So, like what is inflation and how does that affect us? The nominal value is just like the quantity of money, like $1 is $1. So we would say $1 now, and we would say $1 in 1950. But we know that the value of those dollars is a lot different. So the real value is adjusted for inflation. And in an economic sense, the real value, it represents the relative value against other goods and services. So it's still $1, but it buys a lot less now in today's, in 2022 dollars than in 1950. To the next slide. And this is a slide of Tim and Jinqui's from BC. So similar to the slide that Tim showed for excise taxes. If you set a nominal price instead of a real price, you erode the minimum price over time by inflation. It goes down over time. So especially that lower one, and then you get some jumps up where the government revisits the price and raises it. But overall, they're going to go down, just like Colin's work that Tim showed. And to the last slide. So I kind of want to make this point that values like prices or our wages, they're always defined in real terms. So it's almost kind of like, if we take the analogy of our wages, this is why we call it like a cost of living adjustment, and we would never say a cost of living increase. Because when you get your CPI adjustment on your wage, you're not getting a you're not getting a raise. And we would never say that as laborers. What we're getting is an adjustment so that our wage doesn't decrease. Prices and wages are always defined in real terms. Otherwise we would, I guess, call it like a nominal price. And the product, if it was a nominal price, if you set a nominal price, obviously the product will become cheaper in relation to other goods and services, because the real value is relative. So if the government were to set a unit price nominally, it's going to decay, it's going to erode over time by definition. So I kind of I don't like saying index minimum unit price, because that's the default. If it's not indexed, it's not a unit price, it's like a nominal unit price. So I would just stay away from that terminology, right? A non-indexed nominal minimum unit price, I'm going to make a definition here. It's an eroding minimum unit price, or an EMUP. So if a government sets an EMUP, obviously it's going to erode over time. If it sets a minimum unit price or a minimum price, those are by definition in real dollars, so it's just the way that we frame it, but prices and wages are always defined in real terms. And that was the last slide. Oh, no, I added one more and I hoodwinked myself. So some reasons to price ethanol instead of pricing a beverage amount. Like I showed in those graphs, it's going to target and remove ultra cheap ethanol from the marketplace. And ethanol is what's the addictive substance. Ethanol is the psychoactive. Ethanol is the carcinogen. We could think about pricing ethanol instead of liters of beverage. Thanks.
Thanks, everyone. Thanks to Adam and Tim and Ashley for your wonderful presentations. And now we've got some time for questions.